what is regenerative medicine? That's one of these bullshit terms that has no meaning. In aesthetics, we do the same thing. We call it this label or that label. No one's ever defined it. And so it means whatever we want it to mean, so we go with it. What are we regenerating?
Not everything that says it's regenerative is regenerative. Inflammation has a biological cost. Understanding the output of this treatment, what is happening in the skin in response to this treatment, which collagens, which proteins am I making, which am I not making, I think it differentiates products straight away.
What does the aesthetics market look like at the moment in the UK? I'm over there.
It's the Wild West. From a practitioner's perspective, there's no regulation. So you can literally start injecting anything you want tomorrow.
If you were both starting as injectors today, what would you do differently in hindsight?
I would start straight away with as deep an education as possible.
Yeah.
If you do that, no rep can ever pull the wool over your eyes, and you will choose the product based on protein synthesis and biological outcome rather than financial deals and marketing and posters and celebrity endorsement and anything, the things we shouldn't be judging a treatment on.
Welcome to Inside Aesthetics, the world's leading podcast for cosmetic practitioners and business owners.
Our podcasts are aimed at medical professionals and should not be used to make medical, legal, or financial decisions. You should get an appropriately tailored piece of advice from a professional in your country.
To show your support and stay up to date with our latest episodes, click the follow button if you're listening on Apple Podcasts or Spotify. And if you're watching our episodes on YouTube, hit the subscribe button as well as the bell icon.
If you're interested in joining our online community, being a guest on the podcast, or would like to work with us, all of our contact details are in the show notes. And now, let's jump into today's episode.
Hey guys, welcome to Inside Aesthetics, the world's most listened to podcast for injectors and cosmetic businesses. Now, if you're watching on YouTube or Spotify, you'll see that we're not in David's bedroom. Why are we here, David, and where are we?
Well, we are in the lovely Wisecast Studios located in Sydney, and we're joined by Dr. Ben Coyle and Dr. Abs all the way from the UK, and they're here because of the launch of a product called Sunekos. So this episode will form part of our Masterclass series where we find out the science of the product, how it works, I guess answer all the burning questions that our listeners want to know, and I guess how it really fits into clinical practice in the real world.
Yeah, now just before we introduce our special guest, a little bit of special podcast news. If you haven't heard already, we're launching a new app called IA Community. That will be coming very, very soon. So we're hoping by mid-March, something
Fingers
like
crossed.
that. Yeah. In a nutshell, it's going to be a new app where it will allow you as a healthcare practitioner or a business owner or even a partner or company to come together, network, share, learn, and basically have a lot of fun.
Yeah.
So look out for that. There'll be a link at the bottom of the podcast description where you can actually put your name down for our wait list, and we'll let you know with more news about that.
Absolutely. Yeah, let's start off with a little bit of introductions and background. So Ben or Dr. Coyle?
Ben is fine. Ben is fine.
Ben, just tell us a little bit about your background, you know, how you've sort of had experience with the Sunekos product, and yeah, just a little bit to familiarise the listeners.
Well, I'm a GP in the UK, so I started general practice 23 years ago. And a couple of years after that, I started in aesthetics. So I've done aesthetics for 21 years now, 22 years this year. Had big clinics, got a smaller clinic now, just a one-room place, which I love. It's just me, my treatments. Don't have to worry about staff or anything like that.
Yeah.
I've been using Sunekos for almost 2 years, actually, because of this chap sitting next to me. So when a couple of years ago, I can't remember what it was that I heard Abs speak about online, and it just turned a switch in me, and it just made me start to ask questions I'd never asked about in aesthetics before, and got me excited about the science in aesthetics. And it started me on a learning journey. I'm still down that rabbit hole. I get deeper and deeper every day, and I've been using Sunekos for most of that time.
Dr. Abs?
Yeah, so my undergrad was actually in dentistry initially. I retired from that many years ago. I find it way too boring, if I'm being completely honest.
Was it cosmetic or sort of more, you know?
By the end of it, yeah, it was just cosmetic. I basically did full mouth reconstruction.
Right.
And that was pretty much it, because I did my master's certificate in that as well. At the same time, I got much more into aesthetics. So now clinically, I do the aesthetic side and longevity side as well. Mm-hmm. Along the way, I became certified in things like sports nutrition. I worked with professional athletes in like professional footballers, cricketers, even Adam Hollyoake, which you guys made, yeah. So quite a varied mix of things, but most of the time now, yeah, it's just aesthetics and longevity together.
Yeah.
Can I ask, why did you both get into aesthetics? I fell into it, and we've all got probably a similar story. Ben, how and why did you get into it?
Well, so I wanted a different challenge to general practice, and my clinical partner that I went through university with, we were throwing ideas around, and at one point we thought about having a Subway store or something, you know, just something different. And then it actually dawned on us that maybe we should do something that we actually have experience in. So we started aesthetics way back in 2004. So I could be here as a Subway store owner or an aesthetics doctor today, and I'm kind of glad.
I want to see you in a Subway sandwich outfit.
What's your favourite 12-foot long, by the way?
Actually, it's
So 12-inch, not 12 foot.
It's not 12 foot. So yeah, that's my background.
Yeah.
I had you down as a meatball guy.
Not far off. Not far off.
And I guess we are kind of living in the world of regenerative health now, and we are seeing that, collision between aesthetics, regenerative health. You're doing things like sports nutrition. It's all sort of coming together to form this, I guess, single skill set. I mean, is that the way you're thinking about it as well, Abs?
Yeah, to an extent. I mean, for me, you look at sports nutrition, you look at aesthetics, you look at the way devices work, and at the end of the day, it's all the same. It's just a way of working with the cell. The cell is producing protein. How is it producing that protein? If you go deep enough in the cell, be it in the context of eating this for a football match, or is it football or soccer here?
So, it depends who you ask.
Okay.
Football. I'm English.
Okay.
Yeah.
And there's 3 Brits here, so we'll call it football today. So depending on what you're eating to optimize your play in a football match versus what you're injecting into the skin to produce this, versus what a laser is doing. At the end of the day, you are triggering pathways in the cell which are the same in terms of producing an output. And so if you go deep enough, it's all the same to me. But we're seeing patients now start to see the link between all those things. If you're a really unhealthy person, you're probably going to be a terrible football player, and you're probably going to have skin that is not great looking as well. And I think that link is becoming more and more known about.
It's like a sweet, isn't it? With a core that is cellular biology, and we put wrappers on the sweet, and then another wrapper and another wrapper, and we're currently in the regenerative wrapper. But actually the common theme, whatever the treatment, whatever the term, is that it comes down to cellular biology.
Should we hit people with a disclaimer before we go any further?
Let's do that. We probably should make clear that this is not a sponsored podcast. We're going to talk about, obviously, a product. We're not encouraging you to use that product. We're all, 3 of us are medical professionals. David's obviously very close in the industry. But, this podcast isn't designed for patients. It's designed for our industry. So hopefully that was clear. How long have you guys worked with Sunekos? I don't know if you remember. I actually met you at Monaco 2022. You're on the stand. You won't remember me because I'd never heard of Sunekos, and I just kind of being nosy. But how long have you worked with them for?
I think now it's probably around 4 or 5 years, roughly speaking.
Okay. Yeah. And you're more like 2 years?
2, coming up on 2.
What does the aesthetics market look like at the moment in the UK? I mean, we're obviously very familiar with how things are in Australia, but you guys have got an interesting landscape over there.
Oh, it's the Wild West. Honestly, it's a horror show. I can laugh about it, but it is an absolute horror show. So from a patient's perspective, it's a lottery. From a practitioner's perspective, there's no regulation. With zero clinical knowledge, experience, know-how, expertise, you can literally start injecting anything you want tomorrow. And there's no regulation to stop you. So people are doing that because there's money to be made, but they're not breaking the law. So it's an absolute horror show. We've obviously talked to a lot of colleagues in the UK, and we've heard similar messages, and it looks like it's an interesting place. But in terms of, I guess, let's go down into a bit more detail. Are practitioners really open to this sort of regenerative space? Is it something that's still a little bit fringe, or where do you think that people are sitting generally?
There's so many issues. I mean, what does that even mean? What is regenerative medicine? Are we allowed to swear on this?
Sure,
go for it.
It's one of these bullshit terms that has no meaning, right? It's like Donald Trump. He ran by saying, "Make America Great Again." What the hell does that mean? If you're a racist, it means let's build a wall. If you're extreme left wing, it means let's go tree hugging every weekend. But because they didn't say what it meant, you paint onto that canvas what you want it to mean. And so they vote. In aesthetics, we do the same thing. We call it this label or that label. No one's ever defined it. And so it means whatever we want it to mean, so we go with it. What are we regenerating? Because most of it, I said this morning to someone, this industry is the inflammation industry most of the time. So why would we regenerate inflammation? There's nothing actually regenerative about most of what we do. There's nothing anti-aging about it either. You go to a clinic, you get this laser or that injectable. 99% of the time, when you go home, you're still aging at the same rate. So where the hell is the anti-aging? And so I think the biggest problem is, yes, there are options to go into this whatever you call as regenerative, and I think people are open, but there's a complete lack of education topic, which is a real shame.
Yeah.
I think from a patient's perspective, the term regenerative means using your body's own capacity to heal itself, rather than sticking in maybe like an HA filler, which is just designed to like fill an area rather than using your body's own capabilities. I think would you agree that's probably what patients...
Well, I was going to ask Ben, because on your website you say I only do regenerative treatments. I think you say that. So what do you mean?
So we're probably going to talk a lot more about this, but to me that means that I'm trying to create a physiological improvement in the skin.
Yeah.
Rather than an inflammatory change in the skin. I'm a big believer in the notion that inflammation has a cost, and I will try to do everything I can in my clinic with my patients to avoid inflammation for that reason.
Yeah.
I think it takes out of the skin's account, and we want to put into that account. We want to build it up. So for me, it's things which build the health of the skin, and not the things which challenge it.
Yeah, I think a lot of injectors, let alone patients, are imagining this transformative, new me, kind of I'm a new person kind of thing, and it's really not that, is it? Work. And then people also mixing the terms of biohacking and stem cells, and
peptides.
It's all kind of in the same area, but I think as injectors, we sort of need to be clear on what we're actually offering for people.
Just buzzwords, right?
Yeah, exactly.
Buzzwords that look good on a poster.
What do your practices look like? Like who are your demographic? Who do you treat, Ben?
Well, funnily enough, since I've gone down the route of focusing on the regenerative side of it, and it is a term, I 100% agree. So much of the industry is about marketing the way we paint it. But what I badge is that, trying to recreate optimal skin health, half of my time is spent in virtual consultations, and they can be around the world.
Right.
So I regularly talk to people. Most of them are in the UK, but I get people from America or South America, North America, Australia, New Zealand, Europe, and it's conversations around how do I make myself and my skin the best version of itself. And so it's the things that come before treatments, before injectables.
Yeah.
Obviously, I have those that I do normal injectable treatments on, although for me now that's just neurotoxins. And I do some other treatments in clinic as well. But in terms of 50% of it is in-clinic treatments, 50% is the virtual consultation, the educational sessions, I suppose.
Yeah. And how about yourself, Abs?
I mean, if you asked me this question a few years ago, it'd be a very different answer to now. In terms of number of patients, my peak, I was probably seeing between 50 and 70 a day.
50 and 70 a day?
Yeah.
Aesthetic patients?
Aesthetic patients, yeah. Which is a lot, yeah. Now I see around 3 or 4 families a month, and that's it. So in terms of regular injectables, there's a few here and there. Patients that I've known for a long time, that's it.
So you're not running a clinic day to day like Ben or most people?
Okay. And I do a lot of the online consulting like Ben as well.
Okay.
And these people that I go and see, I'll see like all the generations for the nutrition, for internal medicine, for the aesthetic side, everything together.
So like a functional aesthetic
100%,
consult.
Yeah. And then if I'm working with athletes, sometimes it might be advising the team, working with the team doctor or individuals as part of that team, but not the rest of the team, whatever it may be. So there's a wide mix that I do now.
Yeah. One of the other buzz terms that's very popular at the moment is natural.
Yeah.
I want natural looking results. What does that mean to you? I mean,
it's just another one of those terms that means whatever the person wants it to mean, doesn't it? I mean, it's all natural. It's all from the world around us. All these chemicals that you see on food, that's natural because it's from planet Earth. So where is the line between what's natural and what's not? I guess from a patient perspective, most of the time they probably mean I don't want to look too physically warped or skewed in facial proportions, which I think is understandable. Yeah. In terms of ingredients and things like that, I mean, it's down to every individual's own definition, what's natural and what's not. Even inflammation is natural.
Yeah.
Doesn't mean it's what you want.
Yeah.
I think that's a good question.
Yeah.
I think it's a tricky question.
Yeah, I think we've kind of moved from being accepting of like overly augmented faces, things that maybe, don't align with, basic physiology and laws of symmetry and all the, Leonardo da Vinci kind of stuff. And it's different around the world. I mean, Jake and I travelled a lot last year, and, in terms of what the general aesthetic was that we were seeing was so different in different parts of the world. So it means different things to different people in different parts of the world. And I mean, what do you think?
Yeah, totally. I was going to ask Ben, because you don't use HA at all, as in HA structural fillers, cross-linked fillers. So what's natural to you? And what do your patients not want that you're offering them?
It is a really good question. I think for me, the first part of the consultation obviously is understanding what a patient wants. So whatever natural means to them, it's understanding that. For the majority of the time, if I could distill it down, the patients walk in or come online and they say, I want to look like the best version of myself for as long as possible, naturally, unfortunately. But I think they mean that they know that I will help them work with the physiology and the lifestyle factors. And so not necessarily doing things to somebody. An awful lot of it, when you're doing a virtual consultation, you're clearly not injecting somebody.
Yeah.
And so, a lot of people will come back to me a couple of months later to have a Sunekos treatment, for instance. But most of it is about the lifestyle factors, the really fundamental things that make skin healthy, that are before any treatment. And, I'm absolutely aghast that, considering the size of the aesthetics industry, we never talk about lifestyle in consultations. I know very few doctors, nurses, practitioners that will start the consultation and focus the consultation on lifestyle factors. But that's got to come before any injectable treatment, because whatever you're putting into the skin has to go into a healthy skin, right, if you want it to have the best results. So it always amazes me that we never talk about that, and I spend a lot of time talking about that.
Yeah. Well, I mean, from my perspective, the entire sort of Western medical structure has been built on response rather than proactive. I mean, maybe you guys are differently, but I'm yet to talk to a doctor who's actually done any study on nutrition, which is like, it's like being a mechanic and not knowing how, oil works or petrol works in your car. So, I mean, it's always been around, what's wrong with you, surgery or a pill. Yeah. There's never been discussions around, well, how do we optimize your health? How do we stop you getting ill in the first place? So I think we are going through that paradigm shift.
Do you know, I think, sorry, Abs, I was going to say, I think we are, and I think to a large degree, patient education is driving that.
Yeah.
Because I think if you're a new practitioner coming into aesthetics, your way of learning is, okay, I'm going to go to a conference. And you go to the conference and there are stands everywhere from the filler companies and all the other different companies, and you go and pick the best of that category. And then you go and listen to somebody else and they tell you why their product is the best. And you take it away and then you look for an adequate training course in toxins or fillers. And that's how you learn. So it's all procedure based.
Yeah.
This product does this for this person, and there's no education behind that. No one's driving that, but patients are now coming in and saying, how does this work? What collagen does it make? And driving those conversations. And I think one of the best ways of upskilling practitioners is to make us feel foolish, exposed. Patient asks us something, we don't know the answer. Hopefully our response to that is not to blag, but to go away and learn.
Yeah. I'll tell you what's changed.
Make you feel foolish.
Always. The GLP-1, craze at the moment, and also menopause medicine, it's getting our patients to understand wider concepts rather than just what they look like.
Yeah.
And of course, with GLP-1s, you think about food and what should I be eating, and muscle and protein and all the rest of it.
Yeah.
So it's sort of catching up. It's just 5 years behind what we were offering.
Yeah.
And that actually brings on to my next question. So 5 years ago, when skin boosters first came on the scene, it was really hard to sell them to patients.
Yeah.
They just wanted the quick fix, the toxin, the volumizing filler. And now it's almost flipped on its head, where HA filler's the bad guy, and everyone wants skin quality and exosomes and regenerative medicine, which I also don't agree with you. You need both. Well, I think you need both. I agree. I mean, what do you think?
I completely agree with you. Fillers are never going to go away.
Yeah.
If you want a volume, there's a couple of options. You might look at a physical implant. You might look at fat transfer. There's dermal fillers. Nothing is going to beat dermal fillers, at least at the moment, in terms of ease of use, reversibility, safety profile, if used appropriately, and so on and so forth. Yeah. The problem is, it's like, and I'm going to give you an analogy. I'm a big car fan, right? So I always use car analogies. When a particular car sometimes comes on the market and it's in limited supply, the price goes through the roof. But then over time, it might plummet through the ground because they realize it's a hybrid and it's very difficult to maintain. And then it's really cheap and everyone buys it. So then the supply goes down again. And then eventually it finds its middle ground. I think in aesthetics, we do the same thing. Something comes out, they go crazy for it because it's brand new, like all the people that were obsessed with fillers. Then we saw all the problems in the media, people looking like aliens. And now the trend is the opposite, which is to dissolve fillers. And then eventually, probably in a couple of years' time, we're going to reach that middle ground. And we go through these cycles. So I don't think it's going to go away. I think it will always be there. But because of that, they're starting to look at skin now. And I think skin is going to probably go through the same thing because the education isn't there. People will use things which, are very quite pro-inflammatory. It's not going to give you anything good long-term. And that's going to have implications. And then it will probably go out the window, and then it will probably find the middle ground again. And we're just going through these cycles, which is a shame.
Yeah.
And if the education was there in the first place, you wouldn't have this. And if you look at I only use Sunekos for skin now. it's never had a trend. It just increases in popularity year over year over year. It's not gone up and then crashed like, exosomes, polynucleotides, all these things.
Yeah.
Yep.
There's no cycle there.
You wait till after this podcast, mate. It's going to go.
So let's talk a little bit more about Sunekos. So you're a veteran with them. You've been there for a long time. Ben told us you recruited him to join the team. So can you tell us a bit more about the company, their philosophies, where they've come from? And obviously they're distributed by Xytide here in Australia and New Zealand, but just give us a bit of a background.
I think the best way to answer that is how I became a customer in the first place, because I was a customer. I didn't start by coming to where I am now. When I was a dentist, I had a couple of patients with pretty bad gum disease, and I followed the protocol that I was taught at uni: refer them or get better, they come back, you carry on. It just never got better. I was like, what the hell's going on? And then they said, look, I'll just see you in 6 months. I can't take this anymore. I said, fine. 6 months later, they came back and everything was fixed. I thought, what the hell happened? And I said, you must have been treated by someone. I said, no. Eventually, it was nutrition. They changed and the gum disease went away, contrary to everything I was taught at university. That gave me more of an interest in nutrition. At the same time, I was more into aesthetics. And I was trying to understand how skin actually produces, or skin cells produce, all these proteins that we talk about: collagen, elastin, fibronectin. When I was studying nutrition more, I understood obesity and metabolism. And then when I got into metabolism more, I understood mitochondrial function. And then I realized that's the same as what we're doing in aesthetics. Okay, metabolism is a balance between anabolism and catabolism, building and breaking down. What are we doing by eating KFC every day? We're growing anabolically to become obese. If we enter, a weightlifting competition when building muscle, that's anabolic growth. What are we doing to skin to produce all these proteins? That's an anabolic decision process. And so there's a commonality between all those things. And in my studies for all of that, I came across a particular paper around year 2021 where it was published by some of the team behind the manufacturer of Sunekos Professional Dietetics in the background. Oh, I love that paper. It's still one of the best papers I've ever read in my life. But that put me on to all the other studies they did. And then I found all the patents. And some of the patents, honestly, don't just take my word for it. Google professional dietetics. Don't look at their products. Go to their patents, and you will see some of the most ridiculous abilities to control what a cell does that you've ever seen. And if I told you some of them, you wouldn't believe me. But it's all real. And I thought you have to have such immense R&D and know-how to get that. Let's have a look at what products they make. Then I found the website and I thought, they got something for aesthetics. Let's have a look. Let's try it. And that's how I became the customer. And that's, and then I got deeper and deeper and nerdier. And it got to the point where I think a year or two ago, I was speaking to the company and I said, look, in your marketing, you're saying you're making these proteins. I'll write you a new list. And I wrote down a whole load of things. And I said, you're actually making that, whether you know it or not. And they said, maybe not. They didn't trust me. Eventually they went and did the test and they said, yeah, you're right, we are actually making these proteins. So now there's more to it, and hopefully I'll direct them in other proteins they're producing as well over time.
So they're an Italian company, right?
They are.
Yeah. Have you guys been to the facility?
I'm at the office quite a lot. I was there a few days ago.
Okay.
I don't really visit the factory very much.
Right.
Frankly, there's not a whole lot to see there. It's just a load of machines.
Yeah, there's a lot of HA made in Italy, or a lot of the brands seem to come from there. Do you know why? I've got no idea.
I suspect it's also to do with the regulations in certain places. So typically, you will find it Japan, France, and Italy. And it's ease of getting the certifications to do all those things as well. And in fact, you touched on a really good point which practitioners don't realize. You can get 5 different products, all with HA, the same molecular weight, same dilution, same concentration, whatever you want, and have 5 different effects in the skin.
Yeah.
And part of that reason is to do with the way it's actually manufactured. There's no education on this, unfortunately. In fact, I put a video on my YouTube talking about HA. I got carried away and it ended up being 5 hours. And I still maintain it's the deepest education on HA anywhere in the world. But what I want people to realize is the way HA is manufactured actually has a direct implication in your patient's ability to inflame or not inflame when you inject it in the skin. For example, the physical, if you could put HA in your hand before a filler company or a skin booster company gets it, the way it physically looks actually plays a role. For example, even in the toxicity level when it's in the skin. Powder versus fiber, for example, which is nothing that's ever been talked about, but it plays a key role. So the HA is extremely important. And that's one of the reasons this product I feel very safe using, because there's never been a recorded adverse event because of the purity that you get from that particular place where it's manufactured.
You raise an interesting point around us not really appreciating
manufacturing.
Yeah, and the differences. I mean, if you think about it maybe in an analogy that everyone understands, if you give 5 different chefs the same ingredients to cook a meal, the same proportions and quantities, they're going to come up with different... The food's going to be entirely different,
Hell's
right?
Kitchen you described there, isn't it? Yeah, you see that every time. So
how do we educate the practitioners listening to this into appreciating the difference in the manufacturing process? Because everyone's, as you said, looking at how much of this ingredient's in there, but they don't understand that kind of nuance.
The good thing about that question is actually a very simple answer, and I don't mean to push my own stuff, but I made a video about it, and I mean, there's only one place in the world that can make HA as a fiber for that ultra purity, and it's called HTL. No affiliation, I don't work for them or anything like that, but it's true. They're the only people that make a fiber. And it's a secret as to how they do it. But I'm pretty certain I reverse engineered their entire manufacturing process in that video, because when I showed them, they said no comment, but they had a smile on their face. So if you do want to know, just watch that video. That's everything you need to know about the manufacturing. And once you watch that, you have an appreciation for what people do with ingredients, as opposed to just writing HA on the box, because it makes a massive, massive difference.
Yeah. Well, it's like when you give a new injector 5 different brands of, cross-linked filler. Yeah. Some are really stiff to push through, some are nice and smooth, some project, some don't, but they're all supposed to be, a 20 milligram per mil filler. Yeah. They're all got different personalities and characteristics. Exactly. Now, Ben, I've got an easy question for you. What is Sunekos? Why are we here? What are we talking about? Just explain it to the listeners who've never seen it or touched it before.
Okay.
I'm glad you gave him the easy one. Yeah.
Well,
go.
Sunekos for me rewrites the script of anything we understand. So as a product, it's hyaluronic acid, uncross-linked, 2 different molecular weights in 2 different products, and each one has 6 amino acids. The 6 amino acids in there, they're not a secret, but they're in a very particular ratio, and the ratio is patented, so it can't be copied. So you've got a hyaluronic acid filler not a filler, a hyaluronic acid and amino acid combination product. What is it used for? I think one of the terms that I think we are going to get perhaps better at using is bioregeneration. So again, it's all marketing at the end of the day, but let's try and unpick that. What are we doing with it? In many ways, I think we're starting with skin, which until we've done any work with it at all, is you usually got a degree of information in there. And I like an analogy of a lecture theatre. The lecturer's at the front on the lectern trying to deliver really important information, and the people next to you are crinkling crisp packets, somebody in front is on the phone, 5 people next to you are having a wild time talking about the party last night. You can't hear anything, you can't focus. That's the noise, that's the information that's going on. And I think most of the time our skin is sitting in an inflamed state, and we can't receive the signals that we should be receiving to make the skin as healthy as possible, and the signal is everything. Sunekos works with the signal in the skin, so it calms down the information on the one hand, and it delivers the signal to the skin that is telling it to be a better version of itself, optimize its function, make more of the structural proteins that we need in the skin. So I guess in its simplest term, it works on extracellular matrix health, and it promotes optimal structure of that extracellular matrix. Nothing else out there at the moment is going to be doing the same as Sunekos. Sunekos is patent protected, so it's probably going to be a long time before anything else does. It will be a different technology that does, and I guess it's that ability to work with the skin to improve its physiology, to improve its structural components that is so exciting about this product.
Yeah.
You can keep your job.
Yeah, you passed. I mean, we had a product called Profilo. You guys know Profilo. That launched to big fanfare 2-3 years ago. And, they talk about a similar type of story, but they call it bio-remodeling, not bioregeneration. Yeah. So I'm not asking you to compare the products, but the theory of that seemed similar.
Well, I mean, Profilo is a good product at the end of the day. I'm not going to knock it, because one way you can differentiate products is to just say, what does it produce in the skin? And I'm not talking buzzwords like youthfulness and tone or whatever. I mean, like, what are the actual proteins that are being produced? Yeah. When you look at that, nearly everything is the same in the world. It's just type 1 and 3, right? On that basis, collagen 1 and 3. On that basis, Profilo, I mean, you've got to give them credit. Like, they do more than that. They do other types of collagen. They've got some elastin as well. On that basis, Profilo is one of the best products in the world because it stands out so much more in that respect. So I can't knock it. But the reason I prefer Sunekos personally is because the list is even longer. And that comes down to the way that the HA is used and the addition of the amino acids as well.
Yeah. Okay. So let's get a bit nerdy and technical. What actually happens?
Sounds like my kind of
We've got someone here who ticks the box.
That's good. So like, what's actually happening? So you inject Sunekos into the skin.
Yep.
Like, what happens on a cellular level once you do that?
So there's a couple of different things happening. Interrupt me anytime if I'm going too deep or not deep enough. It's entirely.
I'm like
our audience are normally driving in their car, their kids to school. So keep it like understandable.
I'll turn myself down. Yeah. So essentially, the HA is doing one job, and the amino acids are doing another job. The HA is doing a very similar job to other products in the market, in the sense that there are receptors for HA, and it's working with those. Now, what's key is the particular type of HA in terms of the molecular weight. Different weights in the body exist in different places only. So this particular place in the body will only have this many kilodaltons of weight because it does that job. And same with everything else. So they do what they do. And then the amino acids, they're working on an entirely different pathway. They are essentially working in a nutrient sensing capacity. And the best way to think about it is, if either of you have kids?
Yep.
Yeah? How old are they?
6 and 8.
Okay. So they have a particular height, whatever they are. If I told you can no longer feed them any protein, what do you think is going to happen? Well, in terms of their height.
They're going to shrink or get smaller and weaker.
Why is that?
They need muscle. They need to build. They need the building blocks to build.
What signals that?
What signals?
Yeah. What tells the body to grow? So this is what's so unique
growth
about
hormone
Sunekos.
and stress. You need stress.
And what signals the production of that?
I'm going to give
Get
up
deeper
now.
and deeper and deeper, right? I'm going to take you back to 5 million years. When we were cavemen, we had to survive by eating whatever we could find, right? And if we had that, every cell doesn't have a pair of eyes to see is there food around. It has inputs and outputs. If that cell receives signals to say, right, nutrients are here, they'll think, right, we must have killed a woolly mammoth. Let's grow this muscle fiber because we ran a lot yesterday or whatever. If it sends no nutrients, let's not grow because we haven't got anything to build with. So let's start repairing damage. And you'll see this in longevity now about autophagy, which is a bit of a buzzword now. They're all linked. You're talking about the same thing. It's why I always say, look as deep as possible and you understand everything as simultaneous as you possibly can. So when you look at those nutrient sensing pathways, they trigger your metabolism. This has nothing to do with Sunekos, by the way. This is just human biology. And so when we use amino acids in that way, we are able to allow the cell to grow optimally, physiologically, not through inflammation or inflammatory defense. As a result of that, and those things working together, we produce the longest official list of proteins. There are other proteins which I can't talk about, which are also made as well, compared to any other product. So it's to do with the way you're utilizing both of those ingredients and working on pathways which literally no other product in the world is able to work on because of the pattern on those pathways.
I got 2 questions. Go back to Ben first. You speak about inflammation, which totally agree. Like, we don't want to have skin that's not healthy, sun damaged or burnt, etc. But the average person walking around in Leicester, do they have measurable inflammation, or is it just a concept that you're trying to
Depends if they've
reduce?
seen Ben or not.
Yeah.
I think measurable only in the sense that you can see the signs of the downstream signs of that. So I think one of the first signs of aging on the skin is pigmentation disorder. So I think fine lines and wrinkles are actually further down structural failure. I think when you start to see scattered pigmentation, changes in pigmentation, that's one of the first visible signs of aging. And I think that's a downstream effect of inflammation. Now, don't get me wrong. Some of it's inevitable. Yeah. We can't stop aging. And I think it's a really important concept as well. We talk about anti-aging too much. We can't stop it. We can slow it down. We can modify it.
Yeah.
So I think measurable, difficult. I think visible, yes. But I think there's inflammation happening behind the scenes before people become pigmented.
Yeah. So
I think everybody has a modifiable element of inflammation happening because for the majority of people, I think it starts with diet.
Yeah.
And, what we're putting in is really, again, it touches on what Ab said. If you take that caveman example, everything that happened in that caveman or woman's body was a result of what they were eating.
Yeah.
In its simplest form. So everything is downstream of that. Our mitochondrial function is downstream of what we put in. And so on the very simplest level, everybody has a degree of inflammation because nobody's diet is perfect.
Yeah. Sorry, question for you, Ab. So the amino acids in the Sunekos, why can't we just ingest them? Why can't we just improve our diet? Do they have to be injected?
It's a very, very good question. So there are two perspectives. You do need to ingest them because you need to have enough. That goes without saying, and I think it's pretty obvious. I won't dwell on that. But what we find is the body will actually respond in specific ways to specific amino acid restriction, deprivation as well. So there are specific proteins and recognition pathways which don't just sense a particular amino acid's presence, but a lack of profiles as well. And it's like playing a chord. When you have certain ones but not others, you get a particular sounding chord, and that triggers certain things to happen. So if you can restrict certain things and control other things, you actually play a certain chord, and that's why you trigger certain types of growth. So you can take enough, but to give people, because I know this sounds a bit wishy-washy to some listeners or viewers, I'll give an example which they probably will know. When you go to the gym, there's lots of supplements. In fact, the gym industry has probably got, fitness industry is one of the most oversaturated industry for supplements, right? But you have something called BCAAs, branch chain amino acids. So why is it that when you look at branch chain amino acid products, they're all the same ratio, or nearly all the same ratio, 2 to 1 to 1, leucine, isoleucine, and valine? Even the bodybuilding industry knows you have to be dumb to mess with that ratio. And if you bring out a ratio that's like 17:9:4 or whatever, they're going to think, are you stupid? Or just as much as possible of also, they'll think, are you stupid? But if you do it in that ratio, they say that's clearly going to make your muscle grow. Okay. We are so far behind the bodybuilding industry and the aesthetics industry when it comes to understanding amino acid profiles. And so that's one example of actually it being common knowledge that specific ratios give specific results.
You got it, David?
Got it, yeah. So what's actually happening to the collagen, the fibrin, the elastin, like when you inject this product into the skin? So
what's happening is that the cell is recognizing that it is in a position of abundance of what it needs to grow. And as a result of that, combined with the high molecular weight that we have, the high molecular weight is absorbing free radicals. At that point, those free radicals can no longer damage us, shall we say, quote unquote, in terms of fibroblasts. And so the fibroblast is recognizing two things. It's sensing the presence of what we inject, the HA and the amino acids, and that is providing the nutrient supply in the right ratio for physiological growth, but it's also sensing a lack of the free radical damage. As a result of that, there's a particular mechanism, and I won't get too technical, but there's a mechanism which senses a lack or presence of oxidative damage and the presence of specific amino acid profiles. And it makes sense that a protein works, that's its symmetry, because you either grow using the protein or you repair, go into autophagy. So that protein, it is recognizing what we give it, and it is recognizing a lack of the free radical damage. Then it's saying, right now it's time to grow as well as we possibly can physiologically, because no inflammation here. Let's make everything we possibly can, like a teenager growing into an adult. You know, they don't make collagen 1 and 3 to go from a baby to go into an adult. They make everything. And so it's triggering those same responses.
How do you explain it to your patients? Because I bet they don't understand that.
Oh, I say exactly that. No.
Word for word.
Yeah. How do I explain how Sunekos works, do you mean, or fibroblast function?
Yeah, I mean, the way I was thinking as you were talking would be, we're going to use an injectable fertilizer for your cells today. That's how I'm thinking of this.
Okay, so this will show you the difference in intelligence level between the two of us. So here's my explanation for patients. Imagine you want to make the perfect cake, and you've got the perfect recipe, your grandma's made it for generations, and you know it requires 2 eggs, 2 ounces of flour, whatever it is you're putting in there. And that represents the structural proteins in the skin, in the dermis. So you have a particular recipe of ingredients that makes a particular cake outcome, or dermis in this case. If you want to make all of those elements in the dermis, if you want to make the perfect cake, you can't mess with the ingredients.
Yeah.
So it's very similar with this. Your skin is healthy if it has collagen 1, collagen 3, but also 4, 7, 17, fibronectin, elastin. These are the major structural proteins in the skin. And here we have a product whose output is all of those proteins. Yeah. So that sets it apart. And I think when you present to a patient that I can give you a product which gives you this perfect cake of skin, or I can give you one which gives you a bit of it, but I'm messing with the recipe and it's not so good, why would I give that product when I've got this one?
Mm. Can I ask, because I only got my hands on a couple of papers that I found about Sunekos, but are the studies that they've done, are they on cells or are they like in real people?
Both.
Right. Okay. So this isn't just theoretical. We've made more collagen 1, 3, 7, whatever. It's translated into actual
absolutely.
patient
There's,
outcomes.
even biopsy studies as well. So there's a combination of all of them.
Okay. Yeah, because, injectors think, well, that's all great theoretically, but my patients actually need to see it in the mirror, otherwise it makes no difference.
You've hit a phenomenal point there. For most products, when we come up with these new products, yes, we do have to test them in the lab and people to see what happens, whatever, that's fine, and we have to do that for obvious reasons. However, there is something which is true regardless of whether you try it in a human being or not, which is biochemistry. If you give some fat cells, availability of fatty acids, and then some insulin, they will take that in. That's empirically observable, and it's the same in vitro and in vivo. Maybe some slight variation, but the underlying physiological principle is the same because biochemistry is empirically observable. Yeah. When you go deep enough in this industry to really understand what is happening within the cell, and you get to the point of understanding mitochondrial function, that is pure biochemistry, which is empirically observable. If you look in vitro at a mitochondrion and it is responding a particular way by triggering a particular pathway, it will do that in a human being as well. So within most cases, you do need in vivo. In certain cases, depending on what you're doing, biochemistry is going to be universal. And just so listeners, viewers know, it's not always needed.
Dramatic transformations when it comes to these types of products. So you mentioned Profilo before. A little bit hit and miss. Some patients love it. Yep. Sometimes you can see results in a before and after photo, something that's really only tangible when you see them in person, or the patient reports it and you as a practitioner might not be able to see it. Why is it that we sort of can't get
consistency,
those consistent dramatic results with these types of products?
Because there's no education on other factors outside of the injectable.
Right.
So for instance, I'll give you an obvious example, but expand it in your own clinic. If we take someone that's heavily diabetic, and we give them whatever injectable, let's take Sunekos or whatever, let's say Profilo, let's not be too biased here. Say we're giving them Profilo to produce whatever proteins that Profilo produces. The fact that they're heavily diabetic means that they have glucose in their interstitial tissues above the homeostatic level, i.e. more than the body would want to put in there by itself. At that point, where's that going to go? Well, it's going to latch onto things like collagen and elastin. So you've got an injectable that's trying to produce these things, and then you're putting a load of carbohydrates in your mouth, which goes and glycates these proteins and takes away their elasticity. And we're not talking about this. There's no education on this. And this is why I set up my online school where I teach exactly this to injectors. And so in that situation, I wouldn't expect a result. And so that's going to be someone who doesn't respond. But as far as I'm aware, when I did my training for Profilo example, no one told me that. But it's a key role. So consistency is not there all the time because there's no education on what affects protein synthesis on a systemic organismal level. It's all very well and good saying put the needle here, inject this much, but if you have no understanding what else plays a role, how are you gonna do anything?
Yeah, I will say that I forget the numbers of how statistically significant the collagen of Sunekos is or the fibronectin, but if we tell our patients that, or even injectors that, they're going to imagine it's the same percentage in skin quality, visibly better, and that isn't reality. I just don't think that's real. We don't see that. They might feel it's a bit plumper, smoother, hydrated, etc., but it's not like a 200% improvement because the fibronectin is 200% better. That's just not real.
And even if you get a certain 200% increase in whatever, you're not taking into account what takes away from that 200, your diet and lifestyle.
Yeah.
So the net result is different from the gross result.
Yeah.
But interestingly, in the virtual consultations that I have, I've had quite a few patients, and one of them I even posted the pictures on online, which I'm never a fan of, by the way, before and after pictures. I think there's too much about that I don't like. But she sent me the pictures unbidden. And all she had changed in the 4 weeks since she saw me was her diet. So we talked about everything else that I normally talk about. And all she changed was her diet. And in particular, she'd got, if you like, a carbohydrate and sugar dial right down. And her skin was transformed. And this isn't about an injectable product. This is a simple lifestyle measure. Her skin was incredible. And she had a picture the year before she came to see me. And she tried to recreate that picture as well as she could because she was so moved. And she realized when she suddenly had gone 2 days and she thought, I've not put any makeup on my skin. And that's what triggered her to thinking how well her skin was looking. And that was just lifestyle factors.
Yeah.
So, the fundamentals have got to be right. And one of the things I love about this product, Sunekos, I'm completely independent of the company. I use it because I love it. And I actually think, I maintain that independence because I think the company behind it probably benefits from that, actually, because when I talk about it so passionately, I'm not paid to talk about it passionately. It's because I love it and I see the results. But that's because I put it into a protocol where I'm also looking at the fundamentals of skin health.
Yeah.
And that changes the game.
Totally. So what does a typical patient journey look like? So patient comes in, you do the consultation, they want to go ahead with this treatment. Just walk us through pre-care, the treatment itself, results, so on.
It's pretty conventional in terms of injectable. There's no major things you've got to prepare the skin with in terms of standard cleaning the skin is going to be enough. There are particular patterns of injecting which you'll adapt to your own clinical practice after you do the training. Aftercare wise, there's nothing major to worry about. I simply clean the skin. If there's any swelling from the appointment, typically maximum, about an hour. That's about it. But most of it is gone by the time they leave the clinic as well. I've never had a bruise, never had prolonged swelling. And then 2 weeks later, they'll come back in, we'll repeat the process, and then 2 weeks after that. So the average is probably about 3 sessions.
Right.
But the nice thing is there's no harm because it's working physiologically, not through inflammation. So I do have 7 patients in London who have it every 2 weeks for life.
Wow.
And there's never any risk because nothing's left. It's all metabolized. So the only time we avoid it is if I'm away, like today, obviously I'm in Sydney, or if they're away. And then we'll just carry on when we're both back in London again.
Right. So there's no risk of occlusions?
No, I mean, I have got it into vessels by mistake before. One of the injection points that you can do, if you wish, is in the nasolabial area, piriform fossa, which is just by the side of the nose. And we have, obviously, for those non-medical there, we have the facial artery coming up in that region, the angular artery. Now, typically when I inject there, I can just rest my finger on there and I can feel like a little ball of what I've injected. Twice, I didn't feel a ball. In fact, when I injected, I saw this line appear. Suddenly it shot up and it shot down. And I realized it filled the vessel and it tracked up and tracked down. I didn't do anything. I just pulled the needle out and gave it a massage and carried on because there's nothing cross-linked. So all that happens is it gets dissipated and metabolized. HA might last 24 to 48 hours in the skin. In the blood vessels, it's probably about 2 to 5 minutes, depending on the molecular weight. So it's disappeared before I've even finished the rest of the injections.
Right. Okay. And Ben, what's it like from a patient perspective in terms of, when are they going to see results? How long are they going to last? I mean, Ab says he treats some patients every 2 weeks. What does it typically look like for your patients?
So again, I'll just preface the answer to that by saying I want to come away from the notion that I'm giving you a treatment that's going to look amazing tomorrow. Mm-hmm. I think that's an old model that I certainly don't work with that anymore. So it's given in a situation in which we're talking about skin health improvement, improving the baseline physiology of your skin. And as a result of that, it's also on the end of a discussion about lifestyle factors that we mentioned. So a patient comes in, has the treatment. Generally, I find that around about the second treatment, which is 2 weeks later, or definitely the third treatment, people are coming in, and the comment I hear most often is, my skin just looks great. People are commenting, what, you've slept well, or you've been on holiday or something, and skin just looks better. So we're talking, a couple of weeks down the line, give those proteins a chance to get into the skin, get integrated into the tissue. And then, of course, over time, so you've got an initial protocol, 3 treatments, 2 weeks apart usually. You can do another one if you want to or more. And over time, life takes over. Inflammation takes over. Stress, physiology, challenges take over. And so the effect wears off. If you like, it crosses over. The decline of our physiology with time, with aging, is stronger eventually than the effect of the baseline physiology increase that you've had with Sunekos. So people come in and they notice in the mirror that their skin is looking like it needs more Sunekos, which I think is actually a great testament to the treatment itself and the results. I find that is probably 4 months to 6 months later. I don't know what you find out.
It's difficult to say. My patient base is very different to most people because they just want it.
Yeah, yours
I have a very different patient base, so it's hard for me to answer that question.
Right. But I think people know when it's time to have another top-up, and that's a single top-up treatment.
Okay. We'll come on to technique and dose and, on-label, off-label, but what is a result supposed to look like? What are you saying to your patient to expect, and who's not a good candidate for it? How do you decide yes or no?
So I'm couching it straight away in the different language of improving skin health. So they come in to me asking for their skin to look as good as it possibly can naturally. And so the conversation is about that. It's not about your look full, your look glowing. I know Abs uses the term sometimes, we're not glowworms. We're not meant to glow because that actually is inflammation. Run into a brick wall, you're going to glow. But that's not what we're looking for. So I'm not doing the treatment to have the great before and after picture tomorrow. And so patients are not expecting that when they have the treatment with me. They're going to look for skin looking healthier, having to use less makeup, less products. And so all my language around it is about this. So patients know from the outset, this is what you're going to get. It's not the radical tomorrow you're going to look so much better, different. It's from this day forward, we're improving your skin's health, and it's going to show. You're going to look healthier.
And do you have any objective tools to measure that in your clinic? You know, you get the odd patient goes, saw nothing, wasted my money. So you kind of want to hang your hat on, well, let's look at some parameters. So do you have anything in your clinic?
So I don't use, you're thinking things like digital photography.
Visio or whatever.
Visio. I don't use those. I don't know if you've ever taken one of those devices apart. I won't talk about particular brands, but effectively you have a camera and some software overlay.
Yeah.
So I know they can help us with some things, but I tend to stay away from them because I've had one of those things used on me and I disagreed with the AI interpretation.
Because it's not a real photo. Yeah.
So I'm not sure how objective they are. I know it's an industry standard.
Yeah.
But I stay away from using those things for that reason.
Yeah, well, I have to say, like, we've got it in our clinic. I don't use the Visio because, you know, my patient doesn't care what they can't see. They care what they can see and what they can feel. So again, it's like a theoretical improvement, but if they don't see it or feel it, what's the point?
Yeah. If a machine says, "Oh, improve by 2%,"
right?
The patient
your pores are a bit tighter. Okay, great.
Oh, okay, brilliant. Then machine said 2%. I love it.
Yeah,
it's just not going to happen.
Yeah,
I think, you know, if I can just coming back to the thing about treatment failure, if you like, again. It's often said, aren't there? There's 3 P's behind that: is the protocol, the practitioner, and the patient, and those things. And I think the practitioner is a big part of that as well. I've been caught out with Sunekos in the past where I've treated somebody's neck, for instance. So I had a fabulous result on a lady here. Her snap test: when you pull the skin, you snap it like this, and you watch the skin recoil back to smooth. It was about 4.5 seconds. She came in. She said to me, "I hate my neck. The only thing that works for my neck is a polo neck, which covers up all the wrinkles." She was obsessed. So I treated her, and her snap test went from about 4.5 seconds to 1.5 after 4 weeks. It was incredible, the change. She absolutely loved it. 2 weeks later, I treated another lady whose neck looked similar, but there was almost no response. And the issue for her was an anatomical change in where the problem is. So she was way beyond the dermis.
Right.
It was the subcutaneous tissues for her that were lacking. There's very little structure in the neck. Nothing in the dermis is going to solve a problem when the problem is elsewhere anatomically. And I think we as practitioners need to be sure what we're looking at and dealing with and trying to treat. And sometimes treatment failure can be because the problem we're trying to treat is not one that this product is ever going to be able to touch.
Yeah, well, that takes us, I guess, to same sort of topic. What is the upper limitations of this product, and when is it time to move to a different modality, and what would that modality be if you were getting a non-respond?
Yeah, I think there's always going to be people that don't respond to most treatments, and at that point, probably something inflammatory may be appropriate. That's when you may look at something like lasers as an example. I just want to give a shout out to one particular laser. I'm no affiliation at all whatsoever, but ultra clear laser. I'm not sure if it's in Australia yet, but it's an incredibly revolutionary laser. It takes out skin, but without a scalpel, and the downtime is probably less than a week. So when someone is getting to the point where they have excess skin, that's beyond.
Is it the little microcores?
Coring.
Yeah, I think it's just launched
laser,
actually. Yeah.
Right.
Yes, it recently launched. I think. Yeah. Great device. But I have no bias to them at all. But when you get to the point where it's excess skin, it's too much for this product. You're not going to remove excess skin with this product. At that point, you are looking at something like the UCL or surgical intervention or something along those lines. But there's nothing to stop people from combining it with other things at the same time. Because when you understand the way this works, the way nutrient sensing pathways work for physiological optimization in cells, there's no one that this is inappropriate for, but there is someone who needs more than just this on its own. Sure.
So in your practice, Ben, if someone is lax and a little bit saggy or, volume deplete, what are you doing or saying with those patients if you're not using those tools that many injectors do use?
I think an honest conversation. Sometimes there isn't always an answer. There are a lot of treatments that will promise to improve the problem, but again, if you're talking laxity, jowl formation in somebody who's 60 years old, the chances are you're talking about a deep, deep plain problem there.
Yeah.
Ligaments, muscles, laxity. Nothing's going to treat that in clinic. No injectable is going to treat that. And I would much rather set that patient on an appropriate pathway, whether that's just that they live with it, or they focus on the grandkids, or whether they go and see.
Set them on a pathway.
Oh, but what about the mid-40-year-old? Early signs, you know, they don't need a facelift, they don't want a facelift, and they're looking a bit tired on the mid-cheek.
Okay. Well, I think the first thing I would talk about is improving baseline skin physiology. Again, coming back to the really boring things, if you like, of lifestyle, because everybody's skin can be improved. And as Abs just said, whatever treatment, ultimately, whether it works or not, you want to put it into an environment that is optimized to receive that treatment.
Yeah.
You've got to do that first. And there's always improvements can be made there. And I think the honesty of saying to some people, I don't have a treatment that will help. I do other things in clinic as well. Microneedling, fantastic treatment if done properly. There's always something you can offer through that.
Yeah.
But I think you always have to have that honesty and say sometimes, this isn't going to improve with any treatment. Not just ones I offer here, but this is not going to improve with a treatment in a clinic.
Did you have any significant complications with those other older products that you don't use now? Did something scare you off or put you off them?
No. It was understanding that inflammation has a biological cost. Understanding the output of this treatment, what is happening in the skin in response to this treatment, which collagens, which proteins am I making, which am I not making. I think it differentiates products straight away.
Yeah.
I think 95%, I think it's probably fair of the market, 99%, collagen 1 and 3. Okay, that's it, it's fine. It provides some volume to the skin, but it's a part of the cake, it's not all the cake. And if I have a product which can make all the cake, that's the one I'm going to use.
You've got a different attitude. I think you still use HA or other products?
Yeah, I still use dermal fillers.
Yeah.
I don't really use toxin that much now. And then devices, I don't keep any devices, but I refer to whoever has the device that I would need. I'm perfectly happy to use the HA fillers still. The one that I use, I've never had any trouble with, and I've never had any complications. Perfectly happy to carry on.
Okay, perfect.
Combination therapy treatments.
Yeah.
A lot of buzz around that at the moment. How do you sort of combine Sunekos with, a device energy-based or treatment and, other potential, HA fillers or other bio-remodellers?
I think there's a couple of different categories there. When you look at the devices, let's be honest, most devices just damage the skin in different ways. It's just a game of how many times can you hit the nail with the hammer. And so when you understand that you're causing some sort of destruction, some sort of inflammation, and the product works to produce everything that it does because it's the opposite of that, just understanding that alone, common sense will tell you, well, clearly don't do them in the same session, but when one is finished, you can go to the other, and that's perfectly okay. There's no problem. When it comes to fillers, I think it's a bit more of a nuanced answer because it depends on which filler. So I was speaking earlier when I said I was treating someone on stage in Munich. Was it Munich? I saw somewhere in Germany, Tegernsee. And when I was demonstrating the technique, we did it, everything was fine, finished up, whatever. The next day, we got sent a picture. The patient's eyes had massively blown up. And it turns out she had some filler in there a long time ago, which she never told us. And it was a particular filler brand that is known to have complications. In fact, if people want to see, there's a paper, Kokoska 2022, which found this filler actually had the highest complication rate of dermal fillers in that area. And she had it. And obviously things blew up. Now, luckily, 24 hours later, it went back to normal. It was fine. But I have had patients with the filler that I use, and I'll do Sunekos days later, and absolutely nothing. They get a great result. So I think with fillers, it's a difficult question to answer because there's such a variation in the quality of dermal fillers on the market now. It's possible to do them quickly after, but even if you have had them years before, sometimes you may be unlucky because they don't know what they had in there. It might be quite pro-inflammatory, and it could still cause a problem. I mean, I had one patient who did microneedling. I think it was 5 years after getting a particular filler brand in a particular area, and just that part of the face had a massive inflammatory reaction because the body kind of woke up to what was underneath in the filler. So the combinations are possible, but it's difficult to talk about combining with particular filler brands because no one's done a study on every filler brand and every combo.
Microneedling, you're a fan of microneedling, but that's trauma, inflammation, no?
It's a really interesting one to understand because, believe it or not, microneedling, if it's done properly, is barrier protective. And now I'm a big fan of skin barrier protection. I know any any of the clinicians out there who focus on the skin barrier. The cornea therapists I know applaud me every time I say this, but skin barrier for me is really critical. And if your skin barrier is messed up, you're in a world of trouble, so sort that first. But actually, microneedling done properly is protective of the skin barrier. Weirdly, when you look at it histologically, the skin cells separate rather than break. And so you can work actually in a non-inflammatory way with microneedling, and that's the real key to it. If you imagine the seesaw of what proteins am I going to release, what signals am I going to release when I microneedle, you can actually tip the seesaw so you release the pro-physiological ones that produce the response that you want in the skin. So it doesn't have to be inflammatory.
It's how you do it. For those listening who want to really understand it a bit more, look at the difference between TGF beta 1 and 2 versus TGF beta 3.
There you go to name them.
We've got one listener question before I forget, and then we'll move on to patients and
NCTF.
protocols.
Yes.
Yeah, so you guys would be aware of NCTF. It's a product by another brand. Yeah, lots of people, I've never used it personally, but
Is
lots
it quite
of people...
new in Australia?
No, but it used to be used kind of topically very... It wasn't on label here for injecting for a long time. I'm not actually sure because I don't use it, but in some countries it's on label. And it seems like a similar concept with hyaluronic acid, a bunch of amino acids and other ingredients.
And everything else.
How would you compare these two?
It's a good question. Let me answer it by telling people how to compare any two products, not just these two. Very, very simple algorithm, which Ben is aware of as well. I simply say to people, well, if there's a product that is yet to come out, let's say next year something comes out, and I'm not there to compare it for you, ask yourself these questions. Number one, which collagen does it make? If it's 1 and 3, it's the same as everything else, okay? How much does it make? Is it the highest amount of any product in the world in a physiological way? Does it produce elastin? Does it produce fibronectin? Now, for me, those are the key questions. Because if it can compete with all that, then it can compete with what I already use, which is Sunekos. If it can't, objectively, without my opinion, just by using even that manufacturer's own website, you can answer those questions, and you'll see that there's not much of a comparison to be made. Now, one reason I'm not impressed by that product is I'm just not sure it was formulated that well. I mean, for instance, we have dextrose in there as well as ascorbic acid, which is vitamin C. But we know that, carbohydrates such as glucose and things like that are very similar to vitamin C in structure. And so if you have a receptor for a cell such as GLUT4 even, it's an insulin dependent receptor. So if you have something like a dextrose in there, that might be able to go in, but what if that locks out the ascorbic acid from entering, in which case how much of that is even bioavailable? This is why the vitamin C requirement, nutritionally speaking, is much lower on a zero carbohydrate diet versus a standard Western diet, which is quite a high amount of carbohydrates, because there's competition for entry through these insulin dependent receptors. So the fact that both of those are in that ingredient list tells me there's no sense in that. There may be something I've missed, in which case I'm more than happy for someone to tell me, and I'm happy to learn. But on the basis of that, plus simply objectively looking at the list of proteins produced, I personally still prefer Sunekos.
Yeah. I mean, I think it's marketed as more of a mesotherapy, sort of hydratory. I don't believe they claim all these different types of collagens, etc. I should also shout out that question from Tracy Dennison, one of our nurse practitioners in the UK. So thanks for the question.
I recognise that name.
Yeah,
Tracy,
I'm sure you'll know Tracy.
Yeah.
So you obviously the face, the neck, prime areas to do the treatment. Where else can you treat it, and sort of what's on label, what's not?
So the hands. Back of the hands, very, very common area to see signs of aging, sun exposed all the time. Slightly different protocol for the hands because you want to have more of the anti-inflammatory component to calm down some of that oxidative stress that you're getting all the time. So face, neck, hands, the common ones with the Sunekos Performer in 1200.
And does the technique differ much between the different areas?
The principle is identical.
Right.
But the way you deliver it may be different based on angles and shapes of the surfaces.
Sure.
But the principle in terms of the depth that you get to, identical.
Okay, so let's talk about face, kind of standard protocol. I did some training about 2 weeks ago with Sunekos. They came to my clinic, and I didn't realize they came in 2 different boxes. I think you mentioned at the start there's a low molecular weight one, and then the other one's a high molecular weight one. So just, Ben, talk us through the standard protocol, I guess.
So the high molecular weight one comes in 2 separate vials, mix them together, and that's injected first in the face. And if you like, that's the thing that calms down that that room that we talked about earlier in the lecture theatre. It calms down the inflammation. It's the anti-oxidation treatment. But in the same session, we then go with the Performer, which is the 200 kilodalton molecular weight, which is just that in the vial. And that's injected more widespread across the face. So you can do the face, you can do the eyes, all with one vial, or you can do the neck. You're not going to get both out of one, so it's one or the other.
Yeah. Okay. And then how many dots would you typically do? What's the downtime? How big is the boluses for each of these products?
So for injection, you're injecting boluses of if it's the 1200, then you've got 0.3 mil in a few places around the nasolabial area, down the side of the face, 0.2 mil, 0.1 mil, depending on where it is. And then the Performer, you're injecting in 0.1 mil boluses across the cheeks, and then either the forehead or the under eye area, depending on the person in front of you. But the under eye area is tiny amounts per bolus. You're just raising a bleb, very, very superficial.
Okay. Now
this is on label, by the way.
Yes.
Yeah.
So we just want to say, when people get experience, they're more than happy to fiddle with the exact positioning.
Yeah.
And that's perfectly reasonable. But the depth you reach should always be the same.
Okay. So again, we're not training people, so we won't say exactly where these points are, but why do they target around nasolabial for those larger boluses? It seems, even though you said there's no risk of occlusion or highly unlikely,
Yeah.
it seems like a different,
It's simply a
unusual
regulatory thing.
Yeah.
So most fillers, as I'm sure you know, are only indicated for nasolabial fold.
Yeah.
When you use them in the jawline, in the cheek, technically you're off label, but it's perfectly reasonable and it's okay. To get a product onto the market, you've got to have a injection pattern.
Okay, so it's an FDA type of
That's literally it.
issue.
Yeah.
If you want to move those things around over here, over there, as long as you're in the right depth and you're using it appropriately, literally no problem whatsoever.
Okay.
Right. You mentioned cellulite, and that sort of coincides with one of our other listener questions. So from Julie Ogilvie from Scotland,
Okay. Oh, yeah.
wanted to know.
I know Julia.
Yeah, there you know everybody. There you go.
She's a great injector, by the way. Great injector.
Awesome. So how does it use for cellulite? What's the protocol, and how have you found the results?
So it's typically used with a cannula because you want to cause a little bit less trauma, less injection points. And it comes in a powder and a liquid. And it's very similar to Sunekos, the rest of the range. The difference is that there's a little bit of addition to deal with the acidity of cellulite without getting too technical on this podcast. But that helps it deal with the acidity, and then the rest of the ingredients are the same as the others. So you can then go and work in the extracellular matrix, rebuild all the things that you've been breaking down, such that you get sort of pseudo herniation of the fat poking through, hence its appearance. Mm-hmm. So when you rebuild all these connective tissues and you put everything in the correct place again, then the appearance improves.
Yeah.
And it's on label indicated for cellulite.
Right.
Most things aren't indicated, and you're actually treating the problem because it's a pathology, as opposed to trying to destroy the area with RF or laser and cover it up, which is not treating it at all. Cellulite is a pathology. It is a disease process, which people don't realize. From a patient's perspective, yeah, it's a visual problem. I get it. It's a cosmetic problem. But as a clinician, you have to understand the pathology. And then you understand you're actually reversing that as opposed to trying to destroy it and make it look flat.
Fair enough. Now, I think, Ben, you said earlier there's an issue with injectors kind of not being able to diagnose the problem before they go in with any particular product. So for necks, that's a tricky area for a lot of us. As practitioners, the challenge of heavy tissues, probably need to see a surgeon. So what type of neck is good for Sunekos? What particular indications are you treating?
Well, the thing from a pathology point of view, the thing you're looking for is dermal tissue structural collapse or failure.
Yeah.
Now, whether you can tell that clinically by looking at someone is not always easy. Honestly, it's experience. It's grabbing the skin, pinching it and seeing what happens. It's the age of the patient. It's the patient's general background status. I don't think there's a simple answer that you can use.
Yeah.
There's no harm in trying Sunekos on anybody. So I think that's important to say. If you're not sure, give it a go and see what happens. Like I said, I had some amazing results on one lady. 2 weeks later, another lady, she was disappointed.
Yeah.
Different anatomical problem, appeared the same clinically.
Yeah. I guess the problem we're trying and avoid is that new product comes on the market, patients go, I know it's indicated for the neck, and then they choose the completely wrong neck and then blame the product saying it's rubbish.
Yeah.
So again, just for our listeners, think about what you're actually trying to treat. Is it crepiness, dryness, necklace lines, whatever?
Absolutely.
But if it's just heaviness and loose skin, forget it. It's totally pointless.
It's very technically sensitive as a product. I'll be very frank here. I'm probably getting in trouble for this, but When I first became a customer, I saw no result in anyone. Like 6 months, I was like, am I just wasting my time? The really reason I stuck with it is because I understood the cellular biology of what's going on. I thought, this has to work because it is working on those pathways. And I have seen the pet patents, which aren't issued without data. So it's got to be me. So it took me a long time to figure out how to inject it. It's going to take you 3 or 4 patients. When you first learned Botox or fillers, you weren't an expert and you were probably nervous in your first time doing it. You probably didn't do it quite right. Just because this doesn't have the risks of fillers and toxin doesn't mean you're going to get it right straight away. I've taught this in almost 40 countries now. Only twice in my life have I seen anyone inject it perfectly first time when it comes to the under eye area. So do persevere with a couple of patients, family, friends, or whatever, and then you'll get the technique.
What are people doing wrong when they're first trying?
Too deep.
Right.
Especially the under eye area, it's always too deep. I mean, even people use what they think is a small needle. If you take a tear trough filler, typically you'll get like a 30 gauge needle, which is relatively fine. That's too big. The size of that needle is bigger than the thickness of the skin. So how can you be in the skin when the instrument is bigger than the whole thing? So I only use a 34 or 35 gauge.
Wow.
And you know, when you get to that level, you've got the TSK invisible needle, which is called the invisible needle for a reason.
Yeah.
It's not actually invisible, but you get what they're trying to say. And that can get in the skin as opposed to underneath. And it's really not easy. You know, I've taught people with 10, 20 years experience and they can't get a single one right. It takes time.
I know you guys don't like polynucleotides, or I think you don't like them, but it's the same with training to get people to get the right depth for that sort of product. They always go too deep.
Yeah.
You're like, no, higher. And I don't know, they're too used to using fillers and not wanting to create a bump.
Yeah, possibly.
So they're trying to hide the bump, whereas it's the opposite for something like Sunekos.
Yeah.
You want to see that bleb.
Yeah, when you're treating the face, you know, if you get no bleb at all, it means you're too deep, you're in the fat.
Yeah.
If you get a bleb and it's white, it's epidermal.
Yeah.
So it's too superficial. So you want to balance where it comes up, but it's skin color. For the under eye, or anywhere in the eye actually, you want it to look so white that you can see the needle clearly through the skin before you've even released the fluid.
Yeah.
So you want it to look like a blister because that's the only layer you can get. It's 0.1 mil thick. You can't separate the different sections of it.
Do you think that Sunekos is best if you had to choose one area? Everyone, at least in Australia that I've spoken to, is saying, I want something for under eye.
Yeah.
Crepey skin, the fine lines when people smile, that kind of skin. Is that where you'd say it performs best?
To be honest, I think most products will show up best there because it's the thinnest skin.
Yeah.
So if you increase the thickness even by 0.1 mil, you've doubled the skin thickness. So it's going to look at its best. So I would say Sunekos shows up its qualities best in the eye, especially for dark circles and Asian skin. However, that's more to do with the physiology and anatomy rather than anything else. But if you want to see what a product is capable of, definitely try the eye and see how it goes there.
Okay, right. Risks and complications.
So
we said there's no risk of,
there's no risk of occlusion because there's nothing cross-linked.
Yep.
I've never had an adverse event or complication, and
with Sunekos or with anything.
With Sunekos, I've definitely had my fair share of other stuff. And I think in about 30 years, the entire company has never had a single adverse event ever reported. And I think it's down to one, the purity. It's extremely, even the amino acids, you can't just go and buy the amino acid they have here. It's made specifically for their spec. The HA is from a company in France, which is the highest quality HA manufacturer in the world. No one else can make it like them. So there's no way that you'll be responding to a foreign body, really. And because the ingredients are very, hate to use this word after our conversation, but natural, shall we say, you're always going to respond in a very physiological way.
Yeah. I mean, you mentioned one with the under eye in Germany, but there was previous product there, but that's going to be a common scenario for all injectors.
Exactly. So if you're injecting into an area where there's something else, it's an unknown.
Yeah.
Even I'm not going to have any idea. But if it's just a Sunekos on its own, you're never really going to have an issue.
Yeah. Okay. Have there been any sort of major reported adverse events?
Zero.
Wow.
My consent form for my patients is one of the simplest ones of all. Because
do you want it? Yep.
Well, the two things I highlight is you might get some bruising and you will almost certainly have some swelling under the eye temporarily because that's what you're doing with the treatment. But that's it.
I have to say that treating the under eye in my training a couple of weeks ago, the bumps... right. Eventually, I got my ass kicked by Keza. Shout out to Keza, the clinical specialist for Xytide.
I'm proud of her.
No, it's fair enough. I said, look, just tell me if I'm doing it wrong. And we had to change it many times because of that depth issue, but also having my needle more parallel to the skin rather than an angle.
That's a big thing, isn't it?
Yeah, I mean, it's different. where was I going with this?
I was going to make a very inappropriate joke, but I won't.
And I was going to say the bumps that you're creating, they were gone in about, I don't know, half an hour, I reckon.
If you've done it right,
it's
that's how long
very
it
good
takes.
sort of downtime in terms of you could go back to work.
Yeah,
in
if
my
it's the
opinion.
face, like the majority of the face, I'll inject, and then if I'm teaching and demonstrating, I'll massage it there and then. Within about 30 seconds, the skin is flat again.
Yeah.
It'll be red because the needle's gone in, but in terms of flatness, it's there straight away.
Yeah.
For the eye, if you've done it right, by the time the patient leaves from let's say 20 minutes after you've injected, probably 3/4 of that swelling has gone.
Yeah, I agree.
And maybe an hour or two max after that, it's rest of it has gone.
Yeah.
Okay.
Because many of the competitor products, it's a day or 2 days.
Yeah.
So,
And even the bruising, actually, I have to say, if you're doing the eye, you will never get a bruise if your injection technique is correct. In my consent form, I guarantee 0 bruising around the
you're
eye.
a brave man.
And when I demonstrate teaching, injecting, I do this thing where I actually look for a vein specifically, and I say, watch me and record me. I'm going to inject on the vein and you won't see a bruise. And the reason is, if you're in the correct layer, there are no blood vessels there.
Yeah, you can't be there.
So you won't get the bruise.
Right. Okay.
Yeah.
So let's talk commercials a little bit. You
Yeah.
said you've got patients coming back every 2 weeks.
Yeah.
It must be a very inexpensive product, or you have very rich patients.
It's definitely the latter.
So what does it look like commercial? I mean, I know you guys are sort of in the UK, but just to give us an idea about, what would a patient expect to pay for this, and what does this look like from your perspective as business owners from a profitability perspective? And if you can't talk specifics, but, just give
By
us
the way,
a
I
general
don't know
idea.
the Aussie prices. I have no
Yeah.
idea. So let's keep
Neither
it to
do
UK.
I, to be fair.
Yeah.
I guess in the UK, the average, if you're doing like from here to here, mid and lower face, the average price for the patient is probably something like between £250 and £450, depending on rich or poor area of the country, roughly speaking.
Per session.
Per session, yeah.
Right.
And the cost of the product is going to be roughly a box of Performer, which is more than one treatment potentially, is probably about £82, I think.
85, I think.
Yeah.
£285.
It's going to be more expensive in Australia for us to buy. I guarantee that. I don't know, but
Right.
UK, cost
Yeah.
prices are
Yeah.
very, very good compared to ours.
Yeah.
Right, okay.
Just because of shipping and taxes and
Yeah.
I think
What's
it's
all that?
fairly comparable to a filler, a typical filler
Right,
price.
okay.
Yeah.
Similar,
I think that's where you're pitching it. Now, you have got 3 treatments in your protocol.
Yeah.
So it's like having 3 fillers, or if you think about something like Profilo, normally 2 treatments.
Yeah.
Similar price to that.
What do people in Australia charge for, let's say, a mil of filler as a rich to a low
You mean,
range?
look, it could be anything from 500 to 1,000 or
Right,
more.
okay.
Yeah.
It's a
So
broad
it's
range.
probably, I would guess it's probably going to be roughly around that 400 to 700 range then,
Yeah.
based on that in Aussie dollars for the patient, that is.
Yeah, okay. Now, I've just been thinking about, if we're making collagen and fibronectin, all this cool stuff,
Yeah.
why do you then need to repeat it at 6 months? And why do you have to do 4? It seems like
Yeah.
it's not making sense. The
It's
logic,
like-
if you're building stuff, why isn't
Yeah.
it staying?
Well, if you eat a meal on Monday, why do you need to eat on Tuesday, Wednesday, Thursday, Friday, Saturday, and
Should
Sunday?
go for a dump.
Yeah.
Slightly different analogy.
podcast. This is my kind of podcast.
No, my analogy was you're building a brick wall or a wall that should be sound.
Yeah. But you've got
It's
to
a bit
remember
different
that
to eating.
if you're building a brick wall, the equivalent to that in the skin is scar tissue.
Yeah.
It's not physiological growth. Because a brick wall is designed, and just to stick with the analogy, but the brick wall is rock solid, it's meant to never change. Physiological production is meant to change because it's meant to be adaptable to the environment. What's not meant to change is scar tissue,
Yeah.
just in case that same trauma occurs. That's why there's a geometry to scars in the geometry of trauma as well. It links up. So in physiological production, you are responding to physiological input, which is nutrient sensing pathways.
Yeah.
And when you realize you're basing it on a pathway which cannot be triggered without putting something in your mouth, and you realize that you have to keep putting things in your mouth to stay alive, then it makes sense why you have to keep going.
Yeah.
So you can do something that is done once, but do you want to scar for the rest of your face?
Yeah, I guess what you're saying is people used to PLLAs and
Yeah.
calcium, etc. You're creating literally a
Exactly. I mean,
A
think about
rod
the
of
physiological
tissue.
growth aspects, like going to the gym and growing big and strong.
yeah.
That's not a one-time thing.
Yeah.
You've got to keep going to get that physiological thing.
Yeah.
And again, that's not permanent, because if you stop eating and training, your body will not maintain that muscle, for its metabolic requirements are higher than what your inputs are.
Yeah.
So it will break it back down.
Okay. Yeah, I guess being the cynic here, is it just hydration? Is it just sort of top-ups of hydration?
No, it's not. It's not actually a hydration product, if I'm honest.
Okay.
There is internal glycosaminoglycan production made, and we've shown that it can continue even 6 months later, even through winter, it continues. But that's a side effect. And it's a side effect because you're working physiologically. So hydration may come, but as a side effect.
Yeah, okay, fair.
Good.
Anyone business questions?
No, I think we pretty much answered them all.
Well, I guess final questions. How long do you reckon it would take for a practitioner to learn? You said it can be a bit tricky with depth and understanding the protocol and then modifying that. So how long did it take you guys to sort of get your head around it?
I mean, no one taught me, if I'm honest. So I'm not a good case. Ben, how long did it take?
Taught yourself over time, didn't you? Like you said, you got the wrong injection depth. So I think it's important to go through the basic training. I don't think the injection technique is difficult. There are some really fine nuances like around the eye, in the neck, like Abs was saying. But I think once you've got the basic injection technique, I think you just have to go away and treat your patients. If you're treating people regularly every week with this product, I would say around about 4 months down the line of doing that, you've got more familiarity. You might you'll see patients coming back. You'll see the results, you'll become familiar with it, and then I think you might start to do things that were not in your training in terms of moving the 1200s slightly more laterally, for instance, and getting confident with that. So I think like with most things, there's a period of time that you need to adjust to get used to this thing, and I would say about 4 months of regular treatment will start to give you the first notion of what I'm doing with this, what it's looking like when patients are coming back.
From a practical perspective, how do you commercially balance that off with patients that may not be getting the best results from those initial cohort of treatments
in that first
you're doing?
4 months?
Yeah, how do you sort of, it's a difficult one, right? Because you're learning, but you're still charging patients and you're not sort of really dialed in with the technique yet. How do you sort of handle that from a business perspective and from a clinical perspective?
Well, I think, again, I would ask in that case, what are you positioning this as a treatment? Because if what we are doing with this injectable is completely different to anything else that we've done before, if we are talking about skin health improvement, you are going to get that in everybody.
Right, fine.
So that's how we set the conversation from the outset. And of course, if you take that to its logical conclusion, you are doing all the rest of the stuff around that as well, the lifestyle factors. So I think everybody's skin is going to be improved.
Right.
How long that lasts is patient specific. But I think those are the things that you need to be thinking about.
Yeah. Did you want anything to that, Abs?
Not particularly. I think the injection technique, I'd always say the eyes, you've never seen that technique before. I guarantee. I mean, I will inject less than a millimeter away from the cornea in the eye. I will inject almost into the base of the follicle in the upper eyelid where the eyelashes are. I don't know of any other product that you can do that with without causing any issues. So come with an open mind if you're going to learn the injection technique, and be prepared to get it wrong for the first handful of patients. And that's perfectly normal. It doesn't say anything about you. It says something about the fact that there's nothing been available in the market that you can inject this way. And then after a few patients, then you'll feel much more comfortable. Do it on friends and family, as I'm sure we all did when we first learned something, and then get that out of the way.
Cool.
And if you do it wrong at the start, there's no downside.
Yeah.
Last couple of questions. These are nothing to do with Sunekos. I'm just interested. Have you guys seen anything in the pipeline at IMCAS or wherever that's exciting you about the future of aesthetics or new products? Or
Probably just different ways to market inflammation, frankly.
That's what I was going to say. I've seen a lot of terms that I don't understand. Redensification and various other new terms that are coming around. My big thing, and we've talked about this before, my big thing is the rebadging of things. Exactly what Abs just said. How do we rebadge and remarket inflammation? So regenerative medicine is a huge thing at the moment, and it's been called that, whatever it is you're providing. Not everything that says it's regenerative is regenerative.
Okay.
I think the only new device that I've seen, or new thing I've seen in the past year, 2 years, that I genuinely stopped and I thought, that's new and it's pretty good and I think it's going to take off, is coring technology.
Yeah.
That just to provide some balance, I've mentioned ultra clear laser here. There is another one called EllaCore.
Yeah.
I think ultra clear is better, just for various reasons, but I think that is going to take off pretty well over the next few years.
Yeah. Laxatine of loose skin's like the holy grail, isn't it?
I've seen
to
results
do
that look surgical, and yet it was done non-surgically, which is just astounding.
Wow. Yeah. Well, we are moving further away from having to move people towards surgical intervention, so it seems like it's the future. Yeah. Well, thank you both so much for your time. It was great to meet you both.
Another question.
Oh, go on then.
I'm just curious. What's your favourite toxin and why? Go.
Bocaccio.
Nuceiva.
Why?
Although I think in US it's called Jeuveau.
That's right.
And I think in other places it's called Nabota. In other places in Europe it's called Nabota. I don't know what it's called in.
It's Nuceiva here.
It's Nuceiva here
and
as well.
Why Bocaccio?
Ease of use, first of all, from my point of view. Nice big vial, like some of the smaller ones are horrendous. Repeatability of results. So I've tried every single one of the toxins out there. I've tried Nuceiva, I've tried all the other ones, and every time I come back to it, because I get exactly what I think I'm going to get from it.
Fair enough. Definitely last question now. If you were both starting as injectors today, what would you do differently in hindsight?
I would start straight away with as deep an education as possible before delving into injectable.
I think we can all say that, yeah.
If you get that first, you know straight away how each injectable is working without having to rely on marketing or some rep giving you things. Yeah. And the same goes for device physics and all these kind of things as well. If you do that, no rep can ever pull the wool over your eyes. Yep. And you will choose the product based on protein synthesis and biological outcome rather than financial deals and marketing and posters and celebrity endorsement and anything, the things we shouldn't be judging a treatment on. So that I would get started on that much earlier than I did.
I think I agree. I would make my decisions based on facts rather than what I'm told and sold. And the second thing I would say is I would spend a lot less on devices than I did when I started, because I think if I ask myself that question, what's the biological cost of this treatment, then there's almost no treatments that I would buy. And I spent a lot of money when I started. I wouldn't do that now.
Yeah, you're not alone. I speak to lots of practitioners every day that overload their balance sheets with devices that they never use, they don't market them, they become superseded. Yeah. So you're not alone.
I mean, if I started a clinic from scratch now, I would have probably maybe 4 devices.
Yeah.
That's it.
I mean, the great thing is now so many devices now are becoming multimodality, so you get a lot out of one unit, you can upgrade them. So,
they cost
common
a fortune
they do.
To buy and then to run.
Absolutely. Yeah, exactly.
Well, gents, it's been wonderful to get to know you, and we're going to see you tonight on stage doing your thing. We're going to come to the launch of Sunekos, so we'll be there to cheer you on. But enjoy the rest of your time in Australia. Yeah. Have you been before? I didn't even ask you.
First time.
Oh, wow.
First time. Well, welcome. You've brought the rain from the UK. Thank you.
I have, and I'm apologising so much now since I come. But it's been amazing to be here. Thank you so much for the invite.
Our pleasure.
Really kind of you.
Have you been here before, Ben?
I was here 25 years ago.
Oh, nothing's changed.
I've got some bad news though about the rain. He's staying here for 2 weeks.
Oh, great.
Sorry.
Get rid of him. Anyway, thank you guys. Really appreciate it.
That was great. Thank you.
Cheers.
We hope you enjoyed that episode, guys. To stay up to date with our latest news and episodes, follow us on Instagram, and we're now on TikTok.
You can also now watch our full video episodes on YouTube and Spotify. So if you like what we do, please give us a like and subscribe. Please also consider joining our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, hints and tips videos, bonus podcast content, and more.
All of our social links, Patreon, and contact information are in the show notes below, and we'll see you in the next episode.